Hi, my name is Anthony Powers, and today I'm measuring the upper extremity of my patient Kirby. So we're going to be doing elbow flexion, and the normal range, according to the American Medical Association, is 0 to 140. So if I can have you come closer, I'm going to go over the test position. So what we're going to do is have him lay down on this, and then shoulder extension and flexion both occur in the sagittal plane. So, and also his shoulder needs to be neutral, and his forearm needs to be supinated as well. What I did here was place the towel underneath his distal humerus in case we have any hyperextension, so then we could catch that. So what I'm going to do is put the fulcrum, or the axis, right on the lateral epicondyle. Move that a little bit. Lateral epicondyle. And then the stationary arm is lateral to the acromion process, which is up here. And then we have the movement arm, which is lateral to the styloid process. And we are reading 0 degrees right here. If you can come here and zoom in. 0 degrees. And Kirby, what I'm gonna have you do now is flex the elbow as far as you can. Still keeping everything aligned where the fulcrum is on the lateral epicondyle. Now I'm gonna take this measurement. The movement arm is on the styloid process, and the stationary arm is aligned with the acromion process. And we are getting a measurement, if you could zoom in on here, 140 right here, if you read that. Perfect. All right, well, thank you very much. Today we will be doing trunk lateral flexion, and the normal range is about 25 degrees according to the American Medical Association. So Kirby, what I'm gonna have Kirby do is you're gonna stand there with no shoes, shoulder width apart, feet shoulder width apart. And so what I'm having you do, Kirby, is you are going to try and bend to the side as far as you can with flexion. Do that right now. As far as you can. So what we want to make sure of is that his right, the lateral side of his right foot does not lift up, and that he's not going in a sagittal plane, because this is a frontal plane movement. So when we have him in this position, what we're going to want to do is we're going to want his pelvic region to be stabilized. And then when he's bending down, we're bending both the thoracic and lumbar spine. So what I'm going to have to do first, if you could come around, what I'm going to have to do first is take my hands and put them on top and around his iliac crest and palpate his L5 or L4, and then go inferior to that, which is L5, and inferior to that is the spinal process, which is where we want to put our fulcrum. Okay. So fulcrum, we're going to put the fulcrum right there, the axis, and then stationary arm is going to be perpendicular with the floor, and the movement arm is going to be aligned with the C7. So Kirby, if you could do that movement again, as far as you can, and stay there. Okay, perfect. So his movement, can you come over here and look at the measurement? So this is aligned with the C7, and looks like we have 32 degrees of lateral flexion. Hi, today we're going to be testing my patient's knee flexion. The normal range is anywhere from 0 to 150 according to the American Medical Association. So I'm having my patient lay flat in a supine position, and this is going to be measured in the sagittal plane. And what we're going to do is, as he flexes, there's going to be a little bit of hip flexion. So what I'm going to do is first get his extension measurements. That's why I put this down underneath, so he's fully extended. So I'm going to put the fulcrum of the axis right lateral to his lateral epicondyle. And then I'm going to put the stationary arm aligned with his greater trochanter up here. And then the movement arm is going to be aligned with his lateral malleolus of his fibula. So this is reading 0. Perfect. So now, Kirby, what I'm going to have to do is I'm going to remove this, and you're going to slide your heel, keep it on the ground the whole time. Before flexion, see how far back you can put it? No. And same measurements. I'm going to put the fulcrum at the lateral epicondyle. The stationary arm is aligned with his greater trochanter, and the movement arm is aligned with his lateral malleolus. And the reading we are getting, let's see, is 108. 108. Up a little bit. There you go. Yeah, 108. Perfect. Thank you. Lastly, what I'm going to be measuring is cervical extension. The normal range is about 75 degrees according to the American Medical Association. So what I'm going to have my patient do is he's going to sit here with his back stabilized for both the thoracic and lumbar spine. And what I'm going to ask the patient to do is look up as high as he can with his mouth relaxed, and this is being measured in a sagittal plane. So first I'm going to have the fulcrum, or the axis, is going to go over the external auditory meatus, and this is going to be at a 90-degree angle to start off, and the stationary arm is perpendicular in this vertical direction to the ground, and the movement arm is going to be aligned with his nostril, which is 90 degrees right now. So Kirby, what I'm going to have you do is look up as high as you can. Starting from 90 degrees, I'm going to go up. And what we got, you can zoom in over here. So we started from 90 degrees, and it looks like now we are at 70 degrees. 70 degrees, yes. All right, well, thank you very much.